Hey everyone, we're going to try something new today and I'm really excited about this. We're going to try a digital specimen walkthrough today. A few friends of mine and myself have been working on this app called Cardioscape, which is available now for Mac OS and Windows. And it's a platform where we're hosting 3D models of heart specimens and allowing those who upload them to go ahead and add labels. And then the users, all of you, can actually view these models, go ahead and rotate them, zoom in and zoom out, and hopefully help refresh or learn cardiac anatomy with an emphasis on the congenitally malformed heart. But I thought today we would just start off with a normal heart. So here is a heart specimen. It would have sat in the chest roughly like this. Anterior surface would be facing out towards you in the screen. The posterior surface would be away from you inside the screen. Left would be over here. Right would be over here. Superior head up here towards the top of the screen, and then inferior legs towards the bottom of the screen here. So we'll start off as we always do. There's no reason to change our approach. We'll go ahead and find what seems to be consistent with the right atrial appendage, at least externally. So here is an appendage that's triangular in shape, broad-based, or pyramidal in shape. So we'll go ahead and start looking at the heart there. So let's get this turned, and then we'll kind of zoom in. And when we zoom into that structure now, we do see that there's pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. When we further look into this atrium, we do see the oval fossa here, which is intact. This little blip right here is actually just an artifact, so this is an intact oval fossa. There is no ASD or intraatrial communication. Here we see the tendon of Todaro, and right below that we go ahead and find the coronary sinus. And the coronary sinus and the tendon of Todaro are two of the three structures that bound the triangle of Koch. The triangle of Koch is bounded by the right-sided atrioventricular valve, the coronary sinus, and the tendon of Todaro. And it's at the apex of this triangle that we expect to find the atrioventricular node, or the AV node, in the heart. And actually, let me try to make this just a little bit brighter. There we go. Hopefully that's a little bit better. So here's the coronary sinus, here's the tendon of Todaro, here's the right-sided AV valve, and the triangle of Koch. Its apex would be here. We would expect the atrioventricular node to live here. Now, as we get to the right-sided atrioventricular junction, we find a 3-leaflet atrioventricular valve. So here's the anterior leaflet, here's the septal leaflet, and here's the inferior leaflet of what does appear to be a tricuspid valve. It's got 3 leaflets, and this septal leaflet here does have connections directly to the ventricular septum, so consistent with the morphologic tricuspid valve. You can see that this ventricle that it leads into does have coarse trabeculations, and there does appear to be a septomarginal trabeculation here, consistent with a morphologic right ventricle. So right atrium that drains into a morphologic right ventricle. So far we do have atrioventricular, concordant atrioventricular connections. As we get into the right ventricular outflow tract here, we do find our first semilunar valve. And here it is. It appears to have 3 leaflets, 1, 2, and 3. Fortunately, how this specimen lies, it's hard to tell how many sinuses, but there are in fact 3 sinuses, 1 here, 2 here, number 3 here. So this is a 3-sinus, 3-valve leaflet semilunar valve. And there are no coronaries arising from it, and this in fact is the pulmonary trunk. Unfortunately, it's transected, so we don't see the left or the right branch pulmonary arteries. And while we're here, it's just of note that the pulmonary valve is entirely supported by muscle. There is no fibrous continuity here with any of the valves in the normal heart. So the pulmonary valve entirely supported by muscle. And it's also important to note that the semilunar valves are truly semilunar in nature. Their annulus actually forms more of a crown shape, and there is no round or oval shaped annulus as we kind of sometimes ascribe to the semilunar valves. So unlike the atrioventricular valves, there's no true annulus of the semilunar valves, although that doesn't mean the construct that we use for clinical planning isn't helpful. So here's a pulmonary valve, pulmonary trunk, and then the branch pulmonary arteries have been transected. So now that we've kind of seen everything here on this right side here, we'll go ahead and go to the posterior aspect of this heart, and we'll rotate it a little bit and get everybody oriented again. We'll zoom out a little bit here. So now we're looking at the heart in essentially what is a parasternal long axis view. The left atrium would be here. Unfortunately, not able to expose it with all the other structures exposed as well, but we would expect it to be smooth-walled with pectinate muscles only confined to within the appendage itself. And then we come across a left-sided atrioventricular valve that has two leaflets. Here's one leaflet here, and then here's one leaflet here. There are no connections between this left-sided atrioventricular valve and the ventricular septum, so consistent with the morphologic mitral valve. And then this is the anterior leaflet, and then the posterior leaflet is here. Okay, and you can see the papillary muscles as well. So here's the more anterior papillary muscle, and here's the posterior papillary muscle. This is a ventricle that has fine crisscross trabeculations consistent with the morphologic left ventricle. And here is the left ventricular outflow tract. Unfortunately, it didn't scan very well because it was kind of hidden, so difficult to see the left ventricular outflow tract, although you can see it here. And here is an aortic valve here, and you can see a coronary arising from the sinus here. And you can see and appreciate that there is fibrous continuity between the aortic valve leaflet and the anterior leaflet of the mitral valve, such that the aortic valve, unlike the pulmonary valve, doesn't have entirely muscular supports, and part of its support is actually fibrous because of aortomitral continuity. So a digital heart specimen of a normal heart with normally located atria, concordant atrioventricular connections, right-handed ventricular topology, and concordant ventricular arterial connections. Certainly download Cardioscape and take a look at it. We have at least 100 specimens right now and plan to continue uploading more. Also a call for anybody who has collections of their own and would like help scanning or help uploading their hearts. We are more than happy to help with that and really aim to make this a repository for 3D models so that people can better understand cardiac anatomy and cardiac morphology.